Hello everyone, on behalf of Moja Aramesh Amitis Health Tourism Company, I'm here with you to introduce to you another one of our medical treatments that we offer to medical tourists in Iran. I'm going to briefly review cataract surgery. Cataract surgery is a procedure to remove the lens of your eye and in most cases replace it with an artificial lens. A cataract usually forms in the lens, causing blurry vision and hence decreasing your vision. A cataract is usually yellow or brown tinted, hence muting the look of colors. It is a common procedure and is considered a safe surgery. That is performed on an outpatient basis, which means you will not be hospitalized after surgery. A cataract surgery is usually recommended if your decreased vision interferes with performing your normal everyday activities, or if the existence of the cataract makes it difficult for your ophthalmologist or your eye doctor to examine the back of your eye. For example, to examine for age-related macular degeneration or diabetic retinopathy. What do we mean by interfering with your normal activities? If the decreased vision causes you to not be able to drive safely or do your job safely, or watch television or read a book with ease without difficulty, or climb the stairs or do your chores around the house, or if bright lights makes it difficult for you to see. These are all considered normal activities that the cataract may interfere with. In these cases, your doctor may recommend this surgery for you. As with any other surgery, cataract surgery also carries risks that you need to consider and discuss with your doctor before the surgery. The risks include infection, inflammation, bleeding, or retinal detachment, or glaucoma, which basically means the increase of the pressure inside your eye, which leads finally to vision, to loss of vision. Other risks may be a drooping eyelid, and finally it may cause loss of vision. Before this, if you have underlying medical complications regarding your eye or etc., these risks may, the probability of these risks may increase, which you will need to discuss before the surgery with your ophthalmologist. Before the surgery, you will be instructed to avoid eating and drinking anything for 12 hours before the surgery. And your doctor may advise you to temporarily stop taking any medications, depending on the type. He will give you antibiotic drops, eye drops, to reduce the risk of infection during and after the surgery. You will also need a companion for this surgery, because after the surgery you can go home but you cannot drive or be on your own, and you will need help around the house, because the surgery may limit your activities such as bending or lifting for a few weeks. In the appointment before the surgery, usually a week before the surgery, your ophthalmologist will perform an ultrasound test of your eye to examine the size and shape of your eye to determine the kind of lens that is needed for your eye. There are different kinds of lenses based on their material. Some of they may be plastic, silicone, or acrylic. Some of them may be rigid, which inserting them and implanting them may require larger incisions and more stitches. And most of them are flexible, which need smaller incisions in the cornea, and then your doctor will fold the artificial lens and place it into the empty capsule where the original lens used to be. And then the artificial lens will unfold itself as it is inserted, and it will become a permanent part of your eye. You will not be able to see it or feel it. The lenses can be categorized in different types based on the vision they provide and the focus they provide. Some of them may be fixed focus monofocal, which has a single focus strength for a distance vision, for reading you may need glasses. The other type is an accommodating focus, again monofocal lens, which still has a single strength focus, but it can respond to the eye muscle movements and shift focus to near or far objects. The other type is multifocal, which operates as a bifocal glasses, which different areas of the lens have different focus strength and allowing for near, medium, or far vision. The other type is for astigmatism correction, which are called toric lenses. If you suffer from significant astigmatism, this lens may be prescribed for you. During the procedure, the kind of lens will be determined by your doctor, and during the procedure, you will, which is again an outpatient procedure, and it takes at most 1 hour. Your doctor will place an eye drop in your eye to dilate the pupil of your eyes, and then you will receive local anesthesia, which means during the procedure you will be conscious. You may be given a sedative to keep you calm, and then the surgeon makes an incision in the cornea on the front of your eye to remove the lens with cataract and replace it with an artificial lens afterwards. There are two methods of this removal of the cataracts. The first and most common type is using an ultrasound probe to break up and remove the lens, in which through a method, procedure called phacoemulsification. Sorry. Your surgeon makes a tiny incision in the cornea of your eye and then inserts a needle-thin probe inside your eye into the lens substance, and then the probe will emit ultrasound waves to break up or emulsify the cataract, and then will suction out the fragments. This is basically the method, and the back of your eye, which is now empty, as we call it, the capsule, will be is where the artificial lens will be implanted. And then if needed, there will be stitches, a few stitches if needed at all. The second method is not very common and is used if there is another eye complication, in which the surgeon will remove the lens in one piece, which requires a larger incision and more stitches afterwards. As I said, the first method is the most common type. After the surgery, this is the whole idea of the procedure. After the surgery, you will experience blurry vision for a few days, which is normal, and it will go away as your eye heals. And colors may seem brighter to you as the new lens is super clear, and before the cataract would, which is a yellow or brown tinted, would mute the looks of colors for you. The day after the surgery, you will have an appointment with your doctor to examine the health of your eye, and a week after that or a month after that, if needed, to examine and monitor the progress of the new eye. After the surgery, for a few weeks or a few days, you will feel itchiness and discomfort, which makes it very important for you to avoid rubbing your eyes. You will be instructed to wear an eye patch or a protective shield after the surgery for a few days, especially during sleep. Full recovery usually occurs after 8 weeks or 2 months. This is the basics of this surgery. And if after the surgery you experience bleeding or pain or swelling of the eyelid, etc., any abnormal change in your eye, you must consult your doctor. Some people may need glasses after the surgery, and this will be determined by your doctor after your eye has fully recovered after the surgery. These are the basics of the surgery, and what we offer you in Iran as Moja Aramesh Ametis Health Tourism Company are 3 packages that offer the same quality of this surgery and only differ in accommodation options. The first and the bronze package starts from $700, which does not include accommodation but includes full medical expenses, lab tests, the surgery itself, the translation, transfer, and that's it. The second package is the silver package, which starts from $760, which include a 2-night stay at a 3-star hotel, and the other options that I mentioned earlier. The third and the golden package offers you a 2-night stay in a 5-star hotel. All these packages offer you as a welcome a 1-day city tour and a welcome dinner as well. If you have any questions or concerns about this surgery, please contact us through our social media or WhatsApp, Instagram, Facebook, and our website amethystmedtour.com, and we will get back to you as soon as possible to accommodate your concerns. Thank you for being with me, and have a good day.